So we're coming up on the holidays and the official winter months, and unfortunately, heart attacks are more common this time of year.
Yeah, and for women, if you think you're doing everything right to stay healthy, you need to pay close attention to your body. That's the advice from a Boulder community health cardiologist.
Tell us why this is such an important thing for women to think about.
Absolutely, especially with increasing age, the prevalence of heart disease among men and women is essentially equal. It is the #1 killer of women in the United States. About 1 out of 3 women will ultimately die of cardiovascular disease. So from a public health perspective, it's a really important disease to try to prevent.
How do we prevent heart disease?
Well, it really starts early in life with control of what we would call traditional risk factors. High blood pressure, high cholesterol, diabetes, being a normal weight, exercising regularly, not smoking. All these things that most of us are aware of, but are still incredibly important to emphasize and educate about. There are other things, and some of them are more unique to women, like polycystic ovarian disease, peripartum, meaning right around the time of birth, cardiomyopathy, sleep apnea, lupus. There are non-cardiac problems that if someone has can raise their risk of heart disease.
Is early diagnosis and recognizing when there is that onset of heart disease, is that important?
Absolutely. The sooner we can get to it, the better. If someone's unfortunately in the middle of a heart attack, the sooner we can get to it, the better. If someone's having earlier symptoms, we can initiate lifestyle modifications, we can initiate medications that can really change the course of the disease. So I've heard a lot of patients say, oh, I felt silly coming in and it turned out that my chest pain was nothing. I would much rather have that be the case than I didn't come in and I had a heart attack.
Well, there are some symptoms that women especially should watch out for that aren't necessarily classic signs of a heart attack. They include shortness of breath, nausea, back pain, and excessive sweating.
So just being aware certainly helps out.